This is Dr. Corey Maas on Looking Your Best, and today we are having a special feature, a thing that's very important to me, and it is taking care of your eyes after blepharoplasty or eyelid surgery, especially upper eyelid blepharoplasty. When we do lower eyelid blepharoplasty, in most cases I'm going behind the eyelid, so I'll fold it down with a special little instrument and make the cuts behind the eyelid, and I'll reduce the fat pads that make the bags under the eyes. And if we need to treat the skin for fine wrinkles, we'll do some type of resurfacing with a laser. It can be fractional laser, active FX, or a chemical peel. Upper eyelids are a little different. So with the lower lids, we're not taking skin. With the upper eyelids, there's excess skin. And I've got model Mona here who's going to help me demonstrate today. She's not having eyelid surgery because she doesn't need it, but she's a good model. When we go to the surgical patient, we're doing this in our pre-op explanation. A lot of people forget it's a lot of information. So really the reason for doing this is to get the information out there. It's good for anybody, whether you're having surgery with Dr. Maas at the Maas Clinic or whether you're having surgery anywhere. It's applicable to anyone having upper eyelid surgery in particular. And the reason for it is when we do upper eyelid surgery, there's a small incision made in the natural crease, which is virtually invisible as soon as surgery is over, because when you open your eyes, the incision is in the crease. So we use dissolvable stitches that come out after 3 days. And as long as you're taking care of those, we'll take them out after 3 or 4 days after the procedure. And that gives us really an opportunity to get very good results with very little downtime. One of the things that affect downtime, however, is swelling of the eyelid. And swelling is mostly affected, there's normal inflammation and swelling, but it's mostly affected if it extends long term by dryness of the eye. And what we want to avoid in eyelid surgery patients is what I describe as getting behind the dryness curve. When the eyelid is swollen, it normally comes down over the lid and moistens the cornea and leaves a nice even layer of tear film, a lot like a windshield wiper would on a car. And when you have a bad windshield wiper, you've seen it, it's sort of splotchy. The water is not evenly distributed over the windshield. The same thing happens with a swollen eyelid. It leaves the tear film unevenly distributed over the cornea, which can make it dry out. In addition, when it's swollen, it's harder for the eyelid to get all the way closed. This is very common after, I would say 99% plus of patients after eyelid surgery have a little bit of incomplete closure. We call that lag ophthalmos. This is not long-term. In fact, it's a complication to have long-term eye closure problems, and I'm very careful about that, as any eyelid surgeon should be. Blepharoplasty is the name of that. But the temporary inefficiency in eyelid closure and blinking also is caused by swelling. Now, the problem is people are bored after blepharoplasty. You can't, you don't look great. You have a little bruising on the upper eyelids. You're not going to any social functions. You're kind of hanging around the house. You can go out and do walking and things like that. I encourage our patients to do that. But you're not going to be going to the opening of the opera or a big social event in that first 4 or 5 days. And so what do people do? They try to read, watch TV, or work on the computer. All three of those things, screen time and reading, cause us to blink less and cause us to dry out more. So amongst the rules, and general rules that we have, are to try to avoid long-term screen time and to use lots of methods to moisturize the eyes. And if we do those two things, keep the eyes rested, icing as much as we can the first 48 hours, and then using good methods of moisturization, we will not get behind the dryness curve. And let me explain that just for a second. Eyelid swelling is caused by dryness, and dryness causes more eyelid swelling. So when you have surgery, you get a little swelling naturally from inflammation, and if you get dry because you're not taking care of that dryness and the inflammation, it causes more swelling, and if it gets more swollen, then the eye gets drier. So the key is interrupting that bad cycle of dryness, swelling, swelling, dryness. It just keeps going with good moisture. And if you do that and you reduce screen time and you reduce long periods of reading, doesn't mean you can't do anything, but 15-minute increments of screen time or book reading are really probably as much as anyone should be doing. So otherwise, we give all the patients an eye drop of some kind. Now there's two kinds of eye drops that you'll find out in the world. One of them are eye drops that come in bottles like this or even larger. And the downside to bottles like this is that all of them, by rule, by FDA rule, have to have preservatives in them. So if you have a 5 milliliter, 15 milliliter, or even a bigger bottle like you would with, like you'd have with contact lens wearers, then there are preservatives. And many people, the preservatives, usually it's benzalkonium chloride, you have something that's a potential irritant. So I just caution everybody about that. And it's the reason why we use these little individual packages of eye drops. And these individual packages, I'll hold them here so you can see them, can be torn off. And when the cap is opened for these little ones, you just pop this cap. There are drops that are ready. There's different kinds of them. Some are a little thicker and some are a little thinner, but they're basically salt water or saline, normal saline water. And some of them have a little bit of extra oil, if you will, in them to keep the eyes particularly moist or lubricated. And there's different brands. I'm not promoting any brand here. I think they're all good brands. Sustained Tears is one of them. You see I have Blink Tears here. All of them are very good if they're used properly. But the method of use of these is a one-time use. We can sometimes get two out of it. But you can see there's a very small amount of fluid in this. And once I pop this cap off, I'll be able to treat Mona. And I'm just going to demonstrate live how we treat it, just to simply put eye drops in. Now this can be done by yourself. You don't need to have an assistant. I'm going to demonstrate it now. But if you're doing it at home by yourself, then the way to do it is to get in the mirror and where you have good lighting and use one eyelid and pull the lid down and put the drop in. Now eye drops are easy because you can aim them and drop them down. The ointment that I'm going to show you is a little bit harder. And we use the eye drops during the day, and I tell people 4 or 5 times a day, but you can never use too many. If your eyes feel tired, it means they're dry. Anytime you think about it, they're dry. If you're spending time on the screen, a computer screen, a TV screen, you probably ought to be using them every 15 minutes while you take a break. So let's get to the actual technique of using eye drops and using eye ointment, and then we'll conclude with a few comments about making sure you don't get behind the dryness curve. We've talked about the eye drops that are disposable, single-use eye drops. Again, these don't have preservatives in them. If you're getting a larger bottle, which is okay, as long as you're aware that there are some preservatives in them that in some people can cause pretty severe eye irritation. So these single-use little eye droppers are, as they sound, very simple. We pop this little cap off. You can see this one's already popped off. And you want your hands to be clean, obviously, when you're doing this. I'm wearing gloves, but you just need to wash your hands. And once the eye drops have been popped off, they're ready for use. Now, anybody that's used eye drops, and most people have over their life, know that you really just sort of lean this over, look up in the sky, look at the drop. You can, once you've got it positioned well, you can, I'm going to just have you lift your chin just a little bit, Mona. And then a lot of people, and I think this is a good idea, just look up above your head. And I'm going to try to get my hand out of the way. The idea is, who's got really long lashes, is just to get one drop on the eye and sort of gives a little jolt. She's got a little tissue in her hand, so if the little runs out, it's fine. And that's really all. And I can tell you that for most people, we probably don't use enough of these. This is a little bit like, and I'm going to come from the side so you can see again. I'm just going to put one drop in. Looking up above your head makes it a little more comfortable so it doesn't hit the cornea directly. And then blinking a couple times is good. One drop of a good product like the ones that we give our patients a week's worth of use is plenty. And sometimes there's enough to do a couple of applications with this. You just want to be careful about keeping the product clean and in the refrigerator, if you will. So that's really that. You can't use too many eye drops. Eye drops throughout the day after blepharoplasty are important. The wound care and healing part of it is really just keeping the incision area moist with ointment. Now, we don't use an antibiotic ointment because they have a tendency to melt and run into the eye unless they're an ophthalmic ointment. So I have my own formulation that I use, which is a little bit like an Aquaphor type of product. It's got a couple of other healing growth factor types of things in it that help to accelerate the healing. But that's on the incision above the lid, and then we're doing the drops. It's really keeping the wound moist and clean, soap and water washes for the face, and then lots of ice and drops during the day. At night, when we're talking about keeping the eye moist, we're going to talk about another product here. And there's many different brands. I'm not promoting this particular brand. It happens to be one we use. But this is actually an ointment. And I don't know if you can see the bottle. It's got a sealed tube on it. They come in very small increments like this is a 3.5 gram tube. And you don't need very much of this, but at night, especially after eyelid surgery, we'll have people apply this. As I said before, the eyelids don't efficiently close right after eyelid surgery because of the swelling. So what we want to do is put a little bead or layer right in the sulcus of the lower eyelid. And the sulcus is I'll show you in a moment what it is. It's very easy to apply. After you blink a couple times, it's a little blurry, but the ointment is distributed over the cornea. I encourage people to wait till right before they go to bed to apply the ointment. You don't want to apply it in the evening and watch TV for several hours or do other things that are drying. You want to apply this right before you go to bed, brush your teeth or whatever, and just think about it, doing it daily like that. And we'll put a little bead, as I'll show you here in a minute. So we pop the cap off of this thing, and it's obviously set up to be proofed. There's a little point on there. And for someone doing this at home, you have to get in the mirror and do this because the little ointment, you need to be able to see where you're going with it. But if you're looking in the mirror, you just simply pull the lower lid down a little bit like this and look up, and then you'll see a little bead of the ointment coming out. And this lower part of the lid is not at all sensitive. So and then I'll just have you blink, and now you see model Mona here has gotten the ointment, and it'll feel a little blurry initially because it is an ointment, but that'll go away quickly. And really, if you're doing it right before bed, it doesn't matter anyway. Now, if you're using it during the day, and in some cases we'll have patients using the ointment during the day, for the first 15-20 minutes, it'll be a little blurry when you blink, but this is a really great moisturizer for the eye in general. For anybody that's got dry eyes, I encourage using something like this, a natural tears ointment. And in some cases, people really get very inflamed for reasons that for whatever reasons. We might use an ointment that has a little bit of steroid or antibiotic on it, in it. And those patients, as long as they don't have glaucoma, in which we don't use steroids, that turns out to be a better source of the product. A better source of improvement is using an ointment that has a little bit of medicine. Typically, the natural tears ointment, though, is just a moisturizer. Using drops, ointment at night, keeping the eyes iced, minimizing screen time are the keys to success in postoperative blepharoplasty care. So, Dr. Corey Maas on Looking Your Best, and just in conclusion, I wanted to say thanks to Mona. And then Mona, when we did the drops, how would you say that feels? Does that feel painful or uncomfortable?
Just for 1 second it gets blurry.
With the ointment?
With the ointment.
And the eye drops, there's some eye drops that can make people feel a little bit blurry for just a moment, but really a couple blinks and it's fine.
Yeah.
And then a lot of people feel like their eyes are really soothed by the ointment. I don't know if you felt.
I feel refreshed.
Yeah, it feels nice because people usually don't know this, but just in general, most people when your eyes are tired, it's because they're dry. That's not just true after blepharoplasty, that's true always. So having some eye drops around is not a bad thing for your eyes in general, and I think that's great. So thanks, Mona. And really important for blepharoplasty, eyelid surgery patients, particularly upper blepharoplasty, upper eyelid surgery, to use eye drops and ointment to keep the eyes moist and not get behind the dryness curve. This is Dr. Corey Maas on Looking Your Best.